Greetings, Fallon Health home health providers. Welcome to your Home Health MedTrack Portal training session. In this training, we are going to cover the following topics: how to access your authorization, how to view order notes and order instructions, how to access the referring documentation that we received from the referring source, how to file for a concurrent request, also known as re-authorizations, how to file for an authorization extension request, and how to discharge your admission once you are finished rendering services. Let's begin. After having been granted access to the MedTrack portal, we will navigate to the MedTrack sign-in page where you will enter the email address you assigned your account profile with. Please disregard the Register Now tab. The Register Now tab is only used internally by IHCS staff. At the bottom center, you have a Forgot Password option. If you happen to forget your password, simply click on Forgot Password. MedTrack will then send you a new link for you to recreate your password and regain access to your account on file. Here you will enter your email address and your password and simply click on Sign In. Once you have signed in, you will be directed to your home profile page. Notice here towards the bottom you have an announcement section. The announcements section is used for integrated home care services to share any information with network providers, such as portal enhancements, portal updates, interface changes, and health plan communications. Looking at your main profile page, you'll notice if you have been granted portal admin access, you will have access to the following 5 tabs: the Home Health/IV Orders and Auths tab, the Admissions tab, the Request Queue, the Support tab, and the Manage Users tab. If you have been granted standard user access, you will only have access to the following 4 tabs: the Home Health/IV Orders and Auths tab, the Admissions tab, the Request Queue, and the Support tab. Now, we're going to be going over a brief description of what the functionalities are for each specific tab before we actually jump into them. The Home Health/IV Orders and Authorizations tab is going to be used for you to access your authorization, view referral documentation from the referring source, view patient information, view order notations and order instructions, and simply update the order status. The next tab is the Admissions tab. Please note, the Admissions tab is where your primary work function will occur. In the Admissions tab, you are going to activate your admission by entering the start of care date, have the ability to process a non-admit for a patient, file for an authorization extension request, file for a concurrent request, and simply discharge your admission once you are done rendering services. Moving on, the next tab is the Request Queue. The Request Queue allows you to track the status of your request. So in the Admissions tab, if you did file for an authorization extension request or a concurrent request, you can track the status of that request in the Request Queue. You can check to see if the request has been approved or still pending to be approved. You also have the option to update a request and also cancel a request if need be. The next tab is a Support tab. By simply clicking on the Support tab, MedTrack will display our contact information for outreach. So for any support inquiries, you can give us a call at 844-215-4264, option 4, or email us at the following supportive email addresses. The following tab is the Manage Users tab. The Manage Users tab will give portal admins the ability to grant additional user access within your organization. So if you have been granted portal admin access, you can edit user profiles and accounts, reassign different MPI locations to specific users within your organization, resubmit registration links, and even revoke user access. So let's begin with the Manage Users tab. By clicking on the Manage Users tab, you will be directed to the Manage Users page. Here you have 2 options and 2 options only: to add a new user or to search by existing users within your organization. Let's start off with adding a new user. Simply click on Add User, and that's going to bring you to the Add Users page. Here, as a portal admin, you have the ability to grant additional user access to either another portal admin or to a standard user. Notice as I toggle back and forth between a portal admin and a standard user, the location field goes away when portal admin is selected. The reasons for that is because all portal admins have what is called global access. Global access consists of portal administrators having the ability to access authorizations and orders for multiple tax IDs and NPI locations a provider operates under. On the other hand, for standard users, you can select the specific NPI location or locations that a standard user will be working or based out of. Next, enter the associate's first and last name, including their email address. Select the proper corresponding NPI location that the user will have access to. EFT permissions will not need to be enabled for Fallon Health portal users. Once all of the corresponding information has been entered, simply hit Save. Once you hit Save, the user will receive an alert from MedTrack to their email address, prompting them to set up a password. Once the user clicks on the link, they will be prompted to set up a password, and they will now have access to the MedTrack portal. It's very important to keep in mind that by default, as a security feature, once you grant user access to a user, the registration link they are receiving via email will only be good for 24 hours. After a 24-hour time period, the link will expire and you will have to resend a new registration link to the user by clicking on the Edit User tab and clicking on Resend Registration Email. Now back to the Manage Users page. Let's talk about our second option, searching existing users within the portal. Here you can search a user by NPI locations, existing user's first and last name, even the user state, whether their account is active, expired due to inactivity, account revoked, and the list goes on, containing different user state options you can search by. You also have the option to search for general results. By leaving all 4 fields in blank, just simply hit Search. MedTrack will then generate those results for you under the Results section. As you see here, I have a total of 37 users. The first column will break it down by the user's first and last name. The second column will give you the user's email address. The third column will give you the user type, whether it is a standard user or a portal admin user. The following column will give you the location that's been assigned to that user. If it's multiple, it will state multiple. The following column gives you the user state the user is currently in. And the last column gives you the option to edit a user's profile. As a portal admin, you can simply click on Edit User for an individual user, and that's going to bring you to the Edit Users page. Here you have the options to upgrade a standard user to a portal admin. You have the option to upgrade an existing email. You have the option to modify, remove, or add existing NPI locations for a user's profile. You also have the option to revoke user access if the user no longer needs access to MedTrack. And you also have the option to resend a new registration email if that registration link expires within the 24-hour time frame. At the bottom, you have a history of events with a date and timestamp of when the user was first granted access. You have a date and timestamp of when the actions were changed and who prompted the changes within your organization. You have the user status column to see the current user state and the email address. That does it for the Manage Users tab. Now let's move over to the Home Health/IV Orders and Authorizations tab. By clicking on the Home Health/IV Orders and Authorizations tab, you will be directed to the Home Health Orders and Auths Management Filters page. Here you can search your orders by state, NPI locations, date parameters which can be modified and removed. You can search by the authorization number, patient's first and last name, or member ID. Keep in mind you do not have to enter information on all 4 search fields. One search field is fair enough to generate your result. Please note that when we submit an order to your agency, you will get an email notification to the subcontractor email on file containing the authorization number. That's the same authorization number you will use to access the order information in MedTrack. Simply copy and paste the authorization number into the search field and simply hit search. Home health authorizations generally begin with an H and a dash. Now let's talk about the order status. By default, when logging into MedTrack, you will notice you have a new and pending order status generated in the search filter. New order statuses represent newly assigned orders to your agency location, while pending order statuses represent a pending outreach for a patient whom you were unable to contact to set up a start of care date to begin rendering services. Once you have entered the corresponding information into the search fields, whether you selected the authorization number, the patient's first and last name, or their member ID, simply hit search. Once you hit search, MedTrack will generate those results for you under the Results section. The first column will identify the name and NPI location the order was assigned to. The second column will list the authorization number. The third column displays the priority in which the order was tagged and assigned to your agency. It's important to look at routine versus expedited. Expedited orders must be processed within a 24-hour time frame. The next column displays the order status, whether new, pending, or complete. Note, new order statuses are newly assigned orders to your agency. Pending order statuses are orders that are still pending for you to make outreach to the patient to determine the start of care date. And complete staffed are orders that you have staffed, meaning you have determined the start of care date with the patient and are ready to begin rendering services. The next column is the category column, which lists an order under the home health category. The next column is the patient column, displaying the patient's first and last name and their phone number for immediate outreach to determine your start of care date. Notice in the patient column, the patient's first and last name contains a blue hyperlink. By clicking on the patient's first and last name, you will be directed to the patient's details page. Here you will have access to all of the patient information, such as the patient's home address, date of birth, height, weight, emergency contact, patient comments, insurance information, medical details, physician details, ordering physician details, and patient notes. Back to the Home Health Orders and Auths Management Filters page. Next, you have the Created column, which displays the date the order was created and assigned to your agency location. And lastly, here you have the Details column. By clicking on Details, you will be directed to the Authorizations Details page. On this page, you will have all the information needed to proceed with rendering your services. You will have the ability to access your authorization, access the referral documentation, identify the IHCS referral coordinator who prepared the order and assigned it to your agency, view patient information, view order instructions, view order notes, and simply update the order status depending on the outreach outcome. Let's start at the top left-hand corner. Notice the authorization number contains a blue hyperlink. By clicking on the authorization blue hyperlink, MedTrack will generate the authorization for you on the top right-hand corner of your screen in a PDF format. You want to simply double-click on the PDF file for your authorization notification to populate. Looking at your authorization, you'll notice at the top, your agency name will be listed, followed by your agency NPI location, followed by the authorization number, Here we have the date parameters that we've approved for the services to be rendered. Under that, you have all the corresponding member information. We have also added the diagnosis codes for the patient along with the service codes approved for the patient to receive. Notice at the bottom, your authorization contains a special instructions section. Generally, the special instructions section provides you with the referral coordinator's contact information for any inquiries that you may have regarding this order. Please use the information provided to you for outreach. Back to the authorizations details page. Under the authorization number, you have the auth span that we've generated for services to be rendered, the NPI location that the order was assigned to. Under that, you have the fax titles. Notice under the fax titles, you may see one or multiple PDF attachments. Those PDF attachments consist of the actual order information we received from the referring source during the prior authorization request. Under that, you have an issued by section. You will notice a first and last name. That is the IHCS Home Health Referral Coordinator who prepared the order and assigned it to your agency. Under that, you have the order type, admission number, admission status, and admission create date. Under that, you have the primary care physician, the referring doctor, and all of the member information along with their phone number, email, and home address. Under that, you have a first viewed by section. The first viewed by section lets Integrated Home Care Services know which staff member representing your agency first logged into MedTrack to view the order. The following, we have the services section, which displays the services Integrated Home Care Services has approved to be rendered to the patient. Note, these same set of services reflect the same exact services located on your authorization. The following, we have order instructions, which display any instructions entered by an IHCS RN staff member, followed by order notes entered by an IHCS Home Health Referral Coordinator. Keep in mind you do have the ability to enter order notes in the order notes section. All order notes entered can be viewed internally by IHCS staff members. And lastly, at the bottom we have the referral status history, displaying the date and time the order was created and assigned to your agency location. Now, let's scroll all the way to the top of the authorizations details page. Here at the top right-hand corner, we have the order status section, which will be updating depending on the outcome of your outreach. Keep in mind, all new orders will be assigned to your agency location in the new status, showcasing that it is a newly assigned order to your agency location. Updating an order to pending status means you have tagged this order as a pending outreach. Some examples of pending patient outreach consist of the following. The patient did not answer their phone. The patient is undecided if they want to proceed with services. Or the patient advised they will contact your agency once they have determined a date and time that best suits their needs for them to be serviced. Updating an order status to complete staff showcases that you have successfully contacted the patient and have communicated and determined a start of care date to begin rendering the services to the patient. This concludes our navigational instructions on the Home Health Orders and Auths tab. Back to our home profile page. Moving on to the Admissions tab. In the Admissions tab, you're going to activate your admission by entering the start of care date. Have the ability to process a non-admit for a patient. File for an authorization extension request. File for a concurrent request. And simply discharge your admissions once you are done rendering services. By clicking on the Admissions tab, you will be directed to the Home Health Admissions tab Filters page. Here you can search your orders, again, by state, NPI locations, created from date parameters which can be modified and removed, This is to search orders by their created date. Start of care date parameters, which can be modified and removed. This is to search orders by their start of care dates, meaning once you have activated an order by entering the start of care date, you can filter your search by the start of care date. You can search by the admission number, which is obtained in the Home Health / IV Orders and Auths tab. You can search by order number, which is the same as your authorization number, patient's first and last name, and/or member ID. Keep in mind you do not have to enter patient information on all 4 search fields. One search field is fair enough to generate your patient result. Here we have the admission status search field, which can be modified to select your specific order searches. New represents all newly assigned orders to your agency locations. Active represent all active orders that have been activated because a start of care date was entered. Please note, a newly assigned order becomes active once the start of care date has been entered. Discharge represents orders that have been discharged due to servicing rendering finalization. NTUC represents orders not taken under care. And non-admits represent orders that have been non-admitted by your agency due to the patient either refusing services or patient has unexpectedly passed away. Once you have entered the corresponding information in the search fields and you have selected your state, your MPI location, either set or removed your date parameters, and lastly have selected one search filter, whether it being the admission number, order number, patient's first and last name, or member ID, simply hit search. Once you hit search, MedTrack will generate your result for you. Here under the results section, MedTrack will generate all total admissions in coordination with the admission statuses selected in the admission status search field. The first column will break it down by MPI location and name. The second column will break it down by the admission number. The third column, the order status. The fourth column, the patient's first and last name with their phone number for immediate outreach. The fifth column is the created column. This displays when the order was created and assigned to your agency location. The sixth column is the start of care column. This column displays the date you enter the start of care date for the admission. And the last column is the details column, where you will be clicking on the Details tab to access all of your workflow options. Let's go ahead and click on the Details tab. Once you click on the Details tab on your newly assigned order, MedTrack will then navigate you to the Home Health Admissions Details page. Here you will have 2 options. The first option is to enter your start of care date and activate your admission. Keep in mind, once you have obtained all of the information needed in the Home Health / IV Orders and Auths tab, and you have conducted your outreach to the patient, and you have determined the start of care date, you will now enter the start of care date here and simply click on Save Start of Care to activate your admission. Your second option is to process and file for a non-admit. Examples for processing a non-admit for a patient are as follows. The patient is refusing services. The patient has been readmitted into a hospital due to an emergency. The patient has transitioned to a different health plan. Or the patient has unexpectedly passed away. If you do process a non-admit, please use the notes sections to explain the reasoning for the non-admit, and fax IHCS a delay of care notification form to our main fax number at 844-215-4265 so that we can report the non-admission status for the patient to the health plan. To obtain a delay of care notification form, please email us at providertraining@ihcscorp.com or visit our website's resource center at www.ihcscorp.com/resource-center. Now back to the start of care date section. Starting at the top left-hand corner, we have the admission number followed by the admission status, which is currently showing as new. Then the admission create date, the forecasted start of care date, the patient ID and name followed by the start of care date section. Then we have the associated order section, the notes history, and the admission status history. Here in the Home Health Admissions Details page, the first step is to enter the start of care date. Keep in mind, by entering the start of care date and clicking Save Start of Care, the admission status will shift from new to active. This is how you activate all newly assigned admissions that have been submitted to your agency location. Once the Save Start of Care is clicked, the page will now shift, generating new location fields and giving you the option to now file for an authorization extension request and a concurrent request. Keep in mind, these options will not be available to you until you activate your admission by entering the start of care date. Here you will notice the non-admit section now goes away. A discharge section is now generated under the start of care date section. And under the associated order section, we now have the option to file for an authorization extension request and a concurrent request. Now let's talk about our two request options, the authorization extension request option and the concurrent request option. It's important to know the difference between both of your request options. The authorization extension request is used for you to buy more time to render the services on the current authorization that IHCS has generated. The concurrent request option gives you the ability to file for additional services, or also known as a reauthorization for continued services. Let's begin by clicking on the Auth Extension Request tab. Once you click on the Request Auth Extension tab, you'll be directed to the Request Auth Extension page. Here at the top left-hand corner, we have the order number displayed, followed by the patient ID, name, and the current expiration date. To the right, we have the admission number and the admission start date. Below that, we have the items displaying the services that have been approved for this authorization. And below that, we have the new expiration date that you will be filing for. So for example, here you will enter the new expiration date on your current authorization that you would like for IHCS to now generate. The request for an auth extension lets IHCS know that you are requesting more time to render the current services on this current authorization. Simply enter the new expiration date and corresponding notes, and you even have the option to upload supporting documentation. Once you are done, simply hit Submit Request, and the request will then be submitted internally to IHCS for review. Keep in mind, the typical turnaround time frame across the board for all requests are 1 to 3 business days, 24 to 72 hours. Also, all requests submitted to IHCS can be tracked simply by navigating to the Request Queue tab, which will be covered later on in this video tutorial. Now back to the Home Health Admissions Details page. Let's talk about our concurrent request option. If you are looking to file for additional services or a reauthorization for continued services for your patient, simply click on the Concurrent Request tab. By clicking on the Concurrent Request tab, you will be directed to the Concurrent Order Request page. Here at the top left-hand corner, you have all the corresponding patient information such as the patient ID, name, date of birth, address, admission number, admission start date, and initial order number. Under that, you have the assessment section. The first field will prompt you to enter the new auth start date that you are requesting the additional services for. For example, if your current authorization ended yesterday, you will need to put in the new date that you will start providing services again. For example, if your current authorization ended yesterday, you will need to put in the new date that you will start providing services again. This date is important and should be entered in the Auth Start Date section. It ensures that there is no gap in the care you provide to your patient. The start date you enter here will match the date on the new authorization that IHCS will create for you. This process helps you continue caring for your patient without interruption. Then simply select, is the patient homebound, yes or no? What specific skilled service is being performed? Explain. Some examples of an explanation consist of, the patient is not making any progress. The patient needs additional services for improvement. The patient is regressing in their expected recovery goals. Under that, you have the question, is the patient caregiver being taught, yes or no? If no, provide a brief explanation. Under that, you have the services section. Here is where you will be selecting the HCPCS codes of the additional services you are requesting for. By simply clicking on the HCPCS code field, you will notice a Rolodex of all the listed codes in the MedTrack system. Here you have all the following codes available for selection. All the 9 codes, G codes, S codes, and T codes. By simply clicking and selecting your HCPCS code from the Rolodex makes it much easier for you when selecting your targeted HCPCS code. Once you have selected your HCPCS code, simply click on the quantity field. Enter your quantity and simply hit Add Service. If you are selecting more than one service, you can revisit the code field, select your secondary service from the Rolodex, enter the quantity again, and simply click Add Service once again. In the case that you have to remove a service line, you can simply click on the Remove button, or if you need to modify a quantity, you can simply click inside the box, adjust the quantity, and simply click outside of the box. Under that, we have the Documents section. Here is where you're going to be uploading your supporting documentation. Supporting documentation consists of the most recent plan of care, any recent notes provided by the prescribing physician, or the primary care physician, or the RN staff member. Please keep in mind that MedTrack only allows the uploading of PDF formatted files. Below that, we have the request notice history, giving you the ability to add any order notations if need be. Once all of the corresponding information has been entered in the concurrent order request page, simply click on Submit Request. Once you have clicked on Submit Request, you will see a green pop-up window to the top right-hand corner of your screen stating request has been submitted successfully. Keep in mind the typical turnaround time frame across the board for all requests are 1 to 3 business days, 24 to 72 hours. Also, all requests submitted to IHCS can be tracked by simply navigating to the Request Queue tab, which will be covered next. Very important to note, if you navigate back to the Home Health Admissions Details page for your order, you will notice a note under Discharge Admission stating, "This admission has open concurrent requests, so it cannot be discharged. Please navigate to the request queue and search by admission number to find related open admissions." This means an admission cannot be discharged until the finalization of a concurrent request review. In the case that a patient has been readmitted into a hospital due to an emergency, or a patient is refusing further services from your agency, or a patient has unexpectedly passed away in the middle of a concurrent request submission, you can cancel your request by navigating to the Request Queue tab and simply canceling out the request, which we will be showing next. Now let's navigate back to the main profile page. Next, we will cover the functions and navigational options in the request queue. On the request queue, you're going to have the ability to track the status of your request. Let's go ahead and click on the Request Queue tab. You will then be directed to the Request Queue page where you have different search fields you can search by. At the top, select your state and MPI location, the start date of when you filed your request. Enter the patient's first and last name or their member ID or the order number. You can also select in the request type section the specific request type that you are searching for. You also have the statuses filter. You can search by new, pending, processed, canceled, partially processed, and auto-approved. Once you have the corresponding information, simply hit search and MedTrack will generate the results for you. Once the results are generated, the first column will show the name and MPI location the order was assigned to. The following column will showcase the date the request was made. The following column, the type of request that you processed. The admission number column. The order number column with the corresponding order number, which is the same as the authorization number. The status column that shows if the order has been processed or pending to be processed. Following that, you have the patient column with the patient's first and last name. Lastly, you have the details column where you can click on the details and view the authorization extension request. Here you have the request details, order number, patient ID and name, current auth expiration date, when the request was created, the requested authorization expiration date, and lastly, the request status. You also have the items listed on the current authorization as well as a notes section. At the bottom of the auth extension request page, you can add additional notations. You can upload any additional supporting documents, and you also have the ability to update and/or cancel an existing request. Examples for canceling a request can vary from patient is refusing further services from your agency, the patient has been transitioned onto a new healthcare plan, and/or the patient has unexpectedly expired. By canceling a request, you can simply just click on Cancel Request. You will then be prompted with a pop-up window stating, "Are you sure you want to cancel this request?" Next, let's cover the Home Health Concurrent Request option. By simply clicking on Details to view the Home Health Request details, you will then be directed to the Concurrent Order Request View page. On this page, you have two options. Here at the bottom, you can simply add additional documentation or notations to update information onto your request. Or in the case that a request needs to be canceled, you can simply cancel a request. Examples for canceling a request can vary from patient is refusing further services from your agency, the patient has been transitioned onto a new healthcare plan, and/or the patient has unexpectedly expired. By canceling a request, you can simply just click on Cancel Request. You will then be prompted with a pop-up window stating, "Are you sure you want to cancel this request?" And those are your navigational options on the request queue. Now back to the main profile page. Lastly, we're going to cover the functions of discharging your admission. Simply use the search parameters to pull up your patient. Once MedTrack has generated your result for you, simply click on the Details tab. By clicking on the Details tab, you will then be directed to the Home Health Admissions Details page. Here at the top left-hand corner, under the Start of Care Date, we now see the Discharge Date section. Once you have finalized rendering services to your patient, enter the discharge date in the Discharge Date field. Next, you have the Notice of Medicare Non-Coverage Issued section. If the Notice of Medicare Non-Coverage was issued to the healthcare plan, You would then select Yes. Enter the date that the Notice of Medicare Non-Coverage was issued, and simply upload the Notice of Medicare Non-Coverage documentation. Very important, the Notice of Medicare Non-Coverage documentation is attached to your authorization on page 3. Integrated Home Care Services automatically attaches the Notice of Medicare Non-Coverage to the IHCS authorization. Here, enter any notes if applicable and simply click on Discharge Admission. In the case that a Notice of Medicare Non-Coverage documentation was not issued to the healthcare plan and to your patient, simply select No. You will then see the reason field populate. Please select a reason that corresponds to your discharge. If it's a standard discharge, you would want to select Other, and in the Notes section, simply state Standard Discharge. Lastly, click on the Discharge Admission. Once you click on Discharge Admission, this will discharge the admission from the MedTrack portal. Keep in mind, all information on your orders are still accessible in the MedTrack portal for your patient. Remember, when searching for a patient order in the Admissions tab, don't forget to update the admission status to Discharge. Simply hit Search, and MedTrack will generate your result for you. This concludes our Fallon Health Home Health Provider MedTrack training session. I hope you have enjoyed this instructional training video. If you need any additional assistance, please contact the provider training team at providertraining@ihcscorp.com, or you can call 844-215-4264, option 4. Thanks for watching. Catch you on our next video.